Hi, thanks for tuning in to part two of Don't Wait for Glaucoma Surgery. Treat yourself with Forskolin and Quercetin. I really need to get a new phone because this phone has no storage, and 4K video would be really nice as well. Just bear with me, it's in my near future. But I left off with describing some of the side effects to be expected with the Forskolin. I believe I left off telling you all that it does have blood thinning effects. It lowers blood pressure drastically. It also dilates the blood vessels. So if you're taking heart medication in the form of calcium channel blockers or nitrates, you should stay away from Forskolin. I'm going to name off some medications. I'm going to list some medications that if you're taking them, stay away from Forskolin, or at the very least, go and talk to your doctor about this. Maybe there can be some adjustments to your medication regimen so that you can include the Forskolin. The list of blood thinners, some blood thinners here, including Forskolin, which is a blood thinner. So if you're taking these, you may want to stay away from this plant, because Forskolin is a plant, by the way. Aspirin, clopidogrel, also known as Plavix, dalteparin, also known as Fragmin, enoxaparin, also known as Lovenox, heparin, ticlopidine, also known as Ticlid, and warfarin, also known as Coumadin. Hypertensive medications, blood pressure lowering medications you may be taking that will definitely have an interaction with Forskolin include captopril, also known as Capitan, enalapril, also known as Vasotec, losartan, also known as Cozar, valsartan, also known as Diovan, diltiazem, also known as Cardiazem, amlodipine, also known as Norvasc, hydrochlorothiazide, also known as hydrodiaryl, and furosemide, also known as Lasix. Okay. Calcium channel blockers that you may possibly be taking. And if you're taking these, stay away from the Forskolin. Amlodipine, which I just mentioned, also known as Norvasc, is also considered a calcium channel blocker. Nifedipine, also under the brand names Adalat and Procardia, nicardipine under the brand name Cardine, and isradipine under the brand name Dinosurc. These definitely will interact with Forskolin. Nitrates you could be taking if you have heart disease, particularly angina, so you're on blood vessel dilating medications such as nitroglycerin and isosorbide. They also have names Nitrobid, Nitrodor, Nitrostat, Imdor, Isortal, and Sorbitrate. If you're taking any of these, they will interact with the Forskolin. Forskolin, you might be thinking, why take it orally? Why not if I find it in an eye drop? If you find it in an eye drop, it can potentially cause eye irritation. So that is why it is not recommended in eye drop form. If you suffer from constipation, you can benefit from Forskolin, as Forskolin actually increases digestion. So it moves food through the digestive tract faster. So if you suffer from constipation, you can benefit from it. Also, if you are into weight loss, always taking supplements for weight loss, you probably already recognize Forskolin. Forskolin actually promotes the creation of enzymes, lipase and adenosine, which release fatty acids from the cells to be burned for fuel in the body. So it actually contributes to weight loss. So that's another benefit of Forskolin that you should also know about, because you might not be wanting to lose weight. And so it can, go either way for you depending on what's important to you. So those are the side effects and potential interactions of Forskolin. In terms of the Quercetin, Quercetin is an antioxidant found in natural food, such as apples, buckwheat, elderflower, eucalyptus, ginkgo biloba, hawthorn leaves and flowers, rue, and St. John's wort. There's also a Chinese and Korean date known as Ziziphus jujuba that Quercetin is found in. I could not find there's basically no side effects associated with it. However, it has been rarely associated with headaches and tingling in the arms and legs. So it is, I have to tell you these things in case you do, choose to embark on trying these alternative therapies. They are all available over the counter. You can find them on Amazon. I'm always telling people go to Amazon because I'm a big Amazon shopper myself.